It actually exceeded my expectations in terms of radiopacity and deliverability. Well, after the first couple of cases, we knew that the radiopacity was excellent. So the promised radiopacity is there, and the deliverability is there. And I'm sure the upcoming clinical trials will give us the clinical data we need to show that the restenosis rate is comparable to the Taxus Liberty, which has been in the market since 2005. Compared to stainless steel, the differences are obvious, that you can go down to much thinner struts and still have the radial strength, which you may lose with the cobalt chromium when you go down with radials, with the thinner strut, but not have the radial strength as stainless steel. So this probably gives you the best of both worlds. You have the radial strength, you have the deliverability, and you can go down to thinner struts. We have had situations where we had to deliver the stent a little more distally than we usually do, especially in a patient with the right coronary artery dissection. We had to deliver the stents through pre-existing long stents up to 76 millimeters and with poor guiding catheter support, and this stent performed very well. I'll be very honest, when the marketing people first used the word conformability, to me, it was just a marketing term that I sort of ignored. And I don't think I saw it angiographically, but it is our routine practice to use intravascular ultrasound in 15 to 20% of our cases, and most of our cases with long lesions. There, I saw the conformability, whereas we had one of the vessels the vessel itself is undulating, and the stent, even at high pressure, followed the vessel lumen perfectly on intravascular ultrasound without straightening the vessel like a thick stainless steel stent might. So I became a believer in intravascular ultrasound. Using intravascular ultrasound in the Taxus element, one of the biggest surprises to me was we are used to doing intravascular ultrasound in stainless steel and cobalt chromium stents, that the element has a very small footprint, very low noise scatter behind the stent, so therefore very few artifacts, and the vessel lumen shows very clearly. Obviously, we would not use any product, stent or otherwise, in our patients for whom we do have a moral and social responsibility that we do not believe in, and not just believe in, firmly believe in. When we first heard about the Taxus element stent, we were reassured by two things. One, the stent platform is different, but the entire platform is covered by a polymer and a drug in the same doses that we've been used to since 2004, which is paclitaxel. Furthermore, the current randomized trial with the Taxus element is completed. We're just waiting for the follow-up and presentation. If there were any problems, especially acute problems, with the stent or the delivery system or acute events, the data safety monitoring board would have stopped this trial a long time. So the fact that the trial continued, that means that the data shows it's at least equal, or if not better, than the existing product. So therefore, we were very reassured in using it in my own patients. This is a deliverable stent, plus it will give them more radial strength in certain situations where they may be concerned, like osteal disease. I think your sales force is an extremely lucky sales force, that they have a very good company backing them up, and they will have more products in their pipeline that other companies can only dream of.